Hello everyone, now let us discuss about 2023 CPT coding guidelines for surgery, respiratory system part 4. In the current session we will be discussing about trachea and bronchi, and the CPT range is 31600 to 31899. Coming to trachea and bronchi, they are again divided into incision, endoscopy, bronchial thermoplasty, introduction, excision or repair, and finally other procedures. The CPT range for incision is 31600 to 31614, and for endoscopy the CPT range is 31615 to 31654, and for bronchial thermoplasty the CPT range is 31660 and 31661, and for introduction the CPT range is 31717 to 31730, and for excision or repair the CPT range is 31750 to 31830. Coming to other procedures, there is only one CPT, that is 31899. First of all, incision. The first CPT is 31600. It deals with tracheostomy planned. The next is 31601. Whenever tracheostomy is performed on a infant younger than 2 years, then the CPT is 31601. The next is 31603. It deals with tracheostomy, emergency procedure, transtracheal. The next is 31605. Tracheostomy, emergency procedure, cricothyroid membrane. The next is 31610. Tracheostomy, fenestration procedure with skin flaps. And for endotracheal intubation, use 31500. And for tracheal aspiration under direct vision, use 31515. The next CPT is 31611. Construction of tracheoesophageal fistula and subsequent insertion of an laryngeal speech prosthesis, for example, voice button or Bloom-Singer prosthesis. The next is 31612. It deals with tracheal puncture, percutaneous with transtracheal aspiration and or injection. The next CPT is 31613. It deals with tracheostoma revision, simple without flap rotation. The next is 31614. It deals with tracheostoma revision complex with the flap rotation. Now coming to endoscopy. For endoscopy procedures, code appropriate endoscopy of each anatomic site examined. For the endoscopic procedures, code the appropriate endoscopy code of the each anatomical site examined. And the surgical bronchoscopy always includes diagnostic bronchoscopy when performed by same physician. This is an important point. Surgical bronchoscopy always includes diagnostic bronchoscopy when performed by same physician. And the codes 31622 to 31651 and also 31660, 31661, they include fluoroscopic guidance when performed. And the codes 31652 and 653 are complete services used for sampling. For example, aspiration or biopsy, lymph node or adjacent structures utilizing endobronchial ultrasound and are reported separately. EBUS, endobronchial ultrasound. Next, coming to code 31654 is an add-on code and should be reported to identify one or more peripheral lesions with transendoscopic ultrasound. Now coming to the first CPT, that is 31615. It deals with tracheobronchoscopy through established tracheostomy incision. And for tracheoscopy, see laryngoscopy codes. They are 31515 to 31574. And for bronchoscopy with endobronchial ultrasound, EBUS, guided transtracheal or transbronchial sampling of mediastinal and or hilar lymph node stations or structures. Then you need to see 31652 to 31653. And for transendoscopic ultrasound during bronchoscopic diagnostic or therapeutic peripheral lesion, you need to refer 31654. The next CPT is 31622. It deals with bronchoscopy, rigid or flexible, including fluoroscopic guidance when performed, diagnostic, with cell washings when performed. The next CPT is 31623. It deals with bronchoscopy, rigid or flexible, including fluoroscopic guidance with the brushing or protected brushings. The next CPT is 31624. It deals with bronchoscopy, rigid or flexible, including the fluoroscopic guidance when performed with bronchial alveolar lavage. The next is 31625. It deals with bronchoscopy, rigid or flexible, with the bronchial or endobronchial biopsy, single or multiple sites. The next is 31626. Bronchoscopy, rigid or flexible, including the fluoroscopic guidance with the placement of fluidical markers, single or multiple, and report the supply device separately when you are coding 31626. The next is an add-on code plus 31627. It deals with bronchoscopy, rigid or flexible, including fluoroscopic guidance with the placement of fluidical markers, single or multiple, with the computer assisted image guided navigation. And 31627 includes 3D reconstruction, and do not report 31627 in conjunction with 76376 and 76377. And use 31627 in conjunction with 31615, 31622, 31626 and 31628 31631 and 31635, 31636, 6382, 634. These are the codes which can be used in conjunction with 31627. This can be used in conjunction with the below listed codes. The next CPT is 31628. It deals with bronchoscopy, rigid or flexible, including fluoroscopic guidance with the transbronchial lung biopsy, single lobe. And 31628 should be reported only once. This is an important point. 31628 should be reported only once, regardless of how many transbronchial lung biopsies are performed in a single lobe. It must be reported only once per lobe. And to report transbronchial lung biopsy performed on additional lobe, use 31632. The next CPT is 31629. It deals with bronchoscopy, rigid or flexible, including fluoroscopic guidance with the transbronchial needle aspiration biopsy, trachea, main stem and or lobar bronchus. And 31629 should be reported only once for upper airway biopsies, regardless of how many transbronchial needle aspiration biopsies are performed in the upper airway or in the lobe. And to report transbronchial needle aspiration biopsies performed on additional lobes, you need to use 31633. The next CPT is 31630. It deals with bronchoscopy, rigid or flexible, including the fluoroscopic guidance when performed with tracheal or bronchial dilation or closed reduction of fracture. The next is 31631. It deals with bronchoscopy, rigid or flexible, including fluoroscopic guidance when performed with placement of tracheal stent, including tracheal or bronchial dilation as required. And for the placement of bronchial stent, see 31636 and 637. And for revision of tracheal or bronchial stent, then see 31638. The next is an add-on code plus 31632. It deals with the transbronchial lung biopsy, each additional lobe. This is an add-on code that must be used in conjunction with 31628. 31628 indicates bronchoscopy rigid or flexible with the transbronchial lung biopsy single lobe. And if additional lobe is performed, additional biopsy is performed on an additional lobe, then you need to code add-on code plus 31632 and use 31632 in conjunction with 31628. And one more important point is 31632. 31632 should be reported only once regardless of how many transbronchial lung biopsies are performed in a lobe. The next add-on code is 31633. It deals with transbronchial needle aspiration biopsy each additional lobe, and it must be used in conjunction with 31629, which deals with bronchoscopy rigid or flexible with transbronchial needle aspiration biopsy, trachea, main stem and or lobar bronchus. For that, if an additional biopsy is performed on additional lobe, then you need to code plus 31633. And like we have said earlier, 31633 should be reported only once regardless of how many transbronchial needle aspiration biopsies are performed in the trachea or the additional lobe. The next CPT is 31634. It deals with bronchoscopy rigid or flexible including fluoroscopic guidance with the balloon occlusion with assessment of air leak with administration of occlusive substance, that is fibrin glue if performed. The next is 31635. It deals with bronchoscopy with the removal of foreign body, and for the removal of implanted bronchial valves, see 31648 to 31649. The next is 31636. It deals with bronchoscopy rigid or flexible with the placement of bronchial stent, including tracheal or bronchial dilation as required, initial bronchus. For the placement of bronchial stent, initial bronchus, the CPT is 31636 and plus 31637 is for each additional major bronchus stunted, and use 31637 in conjunction with 31636. The next CPT is 31638. It deals with bronchoscopy rigid or flexible with revision of tracheal or bronchial stent inserted at previous session. Revision of the stent. Revision of tracheal or bronchial stent inserted at previous session. It includes tracheal bronchial dilation as required. The next is 31640. It deals with bronchoscopy rigid or flexible with excision of tumor. The next CPT is 31641. It deals with bronchoscopy rigid or flexible with the destruction of tumor or relief of stenosis by any method other than excision. For example, laser therapy, cryotherapy, etc. And for bronchial photodynamic therapy, report 31641 in addition to 96570 and 96571 as appropriate. The next is 31643. It deals with bronchoscopy rigid or flexible with placement of catheter for intracavitary radio element application. And for intracavitary radio element application, you need to see 77761 77763, 77770, 77771 and 77772. The next is 31645. It deals with bronchoscopy rigid or flexible with the therapeutic aspiration of tracheobronchial tree initial. The next CPT is 31646. It deals with bronchoscopy rigid or flexible with the therapeutic aspiration of tracheobronchial tree subsequent same hospital stay. And for catheter aspiration of tracheobronchial tree with fibroscope at bedside, use 31725. The next CPT is 31647. It deals with bronchoscopy rigid or flexible with balloon occlusion when performed assessment of air leak, airway sizing and insertion of bronchial valve, initial lobe. The next is an add-on code plus 31651 that must be coded for each additional lobe. And 31651 should be used in conjunction with 31647. The next CPT is 31648. It deals with bronchoscopy rigid or flexible with removal of bronchial valve initial lobe. And for the removal and insertion of bronchial valve at same session, refer 31647, 31648 and 31651. The next is an add-on code plus 31649. It deals with removal of bronchial valve each additional lobe. Previously it is initial. 31648 is the initial lobe, and with removal of bronchial valve each additional lobe you need to report 31649 for each additional lobe, and 31649 should be used in conjunction with 31648. The next is 31652. It deals with bronchoscopy rigid or flexible with endobronchial ultrasound guided tracheal, transtracheal and or transbronchial sampling. For example, aspiration, biopsies, 1 or 2 mediastinal and or hilar lymph node stations or structures. The next is 31653. It deals with bronchoscopy rigid or flexible with endobronchial ultrasound guided transtracheal and or transbronchial sampling. Here, 3 or more mediastinal or hilar lymph node stations or structures. Whereas 31652 deals with 1 or 2. And 31653 deals with 3 or more mediastinal and or hilar lymph node stations or structures. The next is an add-on code plus 31654. It deals with bronchoscopy rigid or flexible with trans-endoscopic endobronchial ultrasound during bronchoscopic diagnostic or therapeutic interventions for peripheral lesions, and use 31654 in conjunction with either 31622, 23, 24, 25, 26, 28, 29, 40, 43, 45 and 46. And for EBUS to access mediastinal or hilar lymph node stations or adjacent structures, you need to refer either 31652 and 31653. And report 31652, 31653 and 31654 only once per session. This is important. They must be reported only once per session. Now let us see an example. A 20-year-old patient is seen for 5 transbronchial lung biopsies. Here 5 biopsies are performed of 2 separate lobes. 1 biopsy is taken in one lobe and 4 biopsies in another lobe. So here the first CPT is 31628. It deals with bronchoscopy rigid or flexible including fluoroscopic guidance when performed with transbronchial lung biopsy single lobe, because one biopsy is taken from one lobe. And one important point is 31628 should be reported only once regardless of how many transbronchial lung biopsies are performed in the lobe. And second is 31632. It is an add-on code and must be used for each additional lobe. Here you can see 1 biopsy is taken in one lobe and 4 biopsies in another lobe. And for another lobe, regardless of number of biopsies, you need to report only 31632 with transbronchial lung biopsy each additional lobe. And 31632 should be reported only once regardless of how many transbronchial lung biopsies are performed in the lobe. Here in this one particular lobe, 4 biopsies are performed. Though 4 biopsies are performed, it must be reported only once for each additional lobe. Next Next, coming to bronchial thermoplasty. The first CPT is 31660. It deals with bronchoscopy, rigid or flexible, including fluoroscopy guidance when performed with bronchial thermoplasty, one lobe. The next is 31662. With bronchial thermoplasty, if it is performed on 2 or more lobes, then the CPT is 31661. And for radiofrequency destruction of pulmonary nerves of bronchi, C 0781T and 0782T. Next, coming to introduction. For endotracheal intubation, you need to refer 31500. And for tracheal aspiration under direct vision, C 31515. Coming to the first CPT here, that is 31717. It deals with catheterization with bronchial brush biopsies. The next is 31720. It deals with catheter aspiration, separate procedure, nasotracheal. The next is 31725. Catheter aspiration, tracheobronchial with fibroscope bedside. The next is 31730. It deals with transtracheal or percutaneous introduction of needle wire dilator or stent or indwelling tube for oxygen therapy. Next, coming to excision or repair, the first CPT is 31750. It deals with tracheoplasty cervical. The next is 31755. It deals with tracheoplasty, tracheopharyngeal fistulization each stage. The next is 31760. It deals with tracheoplasty intrathoracic. The next is 31766. It deals with carinal reconstruction. The next is 31770. It deals with bronchoplasty graft repair. The next is 31775. It deals with bronchoplasty, excision of stenosis and anastomosis. And for lobectomy and bronchoplasty, use 32501. The next is 31780. It deals with excision, tracheal stenosis and anastomosis cervical. The next is 31781. It deals with excision, tracheal stenosis and anastomosis cervicothoracic. The next is 31785. It deals with excision of tracheal tumor or carcinoma cervical. And for thoracic region, and that is the excision of tracheal tumor or carcinoma thoracic, the CPT is 31786. The next CPT is 31800. It deals with suture of tracheal wound or injury cervical. The next is 31805. Suture of tracheal wound or injury intrathoracic. The next is 31820. It deals with surgical closure, tracheostomy or fistula without plastic repair. Surgical closure, tracheostomy or fistula without plastic repair. If it is done with the plastic repair, the CPT is 31825. And for repair tracheoesophageal fistula, C 43305 to 43312. The next is 31830. It deals with revision of tracheostomy scar. And finally, coming to unlisted procedures, there is only one CPT 31899. Unlisted procedure, trachea, bronchi. It is given under other procedures. Now let us see an example. An ICU diabetic patient who has been in coma for weeks as the result of the head injury becomes conscious. He is in coma because of head injury. Though he is a diabetic patient, he is not suffering from diabetic coma. Remember that. He is in coma as a result of head injury, becomes conscious and begins to improve. The physician performs a tracheostomy closure. And since the scar tissue is minimal, plastic surgeon is not required. That is without plastic repair. So the CPT is 31820. It deals with surgical closure, tracheostomy or fistula without plastic repair. Thank you for watching. Please subscribe for further videos on medical coding